Welcome back to the Contact Lens Institute channel. I'm Dr. Stephanie Wu, and today we're going to be talking about the differences between myopia and hyperopia. So myopia is also known as nearsightedness, and hyperopia is also known as far-sightedness. Those two terms kind of give us a guide on what type of vision that specific patient has. So for myopia, nearsightedness, what that means is you can usually see something near. So if you're looking at your phone or you're reading a book, you can usually see it. But when you look far away, so let's say you're looking at the street signs or you're looking at a board in a classroom, or generally just looking in the distance, things are blurry. That's a very, very quick test to find out which one you have. So if you can't remember whether you were diagnosed with myopia or hyperopia, if you can see your phone up close pretty clearly, and then you look far away, way across the room, and things are very blurry, you most likely have myopia. Hyperopia is a bit different. Far-sightedness. What this is telling us is you can see far, but you can't see up close. So in some patients that have extreme hyperopia, they're able to see like a hawk far away. They can see the mountain through the window. They can see the person that's hiking up the mountain, no problem. But when they go to look at their phone or read something up close, it's blurry. Hyperopia is a little bit more challenging to diagnose because when you're younger, or if you only have a very small amount of hyperopia, you can actually see far and up close perfectly, and you don't know that you have it. Some of the things that you might have if you have hyperopia would be symptoms such as headaches when you're reading, especially if you're reading long periods of time. Let's say you're reading for more than 30 to 60 minutes, and you really start to get a headache right around your temples or in the front of your head. That could be a sign that you have hyperopia. Also, seeing double. If you're reading for a long period of time and you notice that the words are really coming in and out of focus, or you're seeing one on top of the other or side to side, that could be another sign that you have hyperopia. Another sign would be, let's say you're doing computer work all day or looking at your cell phone all day, and at the end of the day, your eyes are incredibly tired and maybe you have a headache as well. That's another sign that you could possibly have a small amount of hyperopia. Now, myopia and hyperopia are treated essentially the same way. Hyperopia and myopia can be treated with glasses, but they're completely opposite prescriptions. So if your friend has hyperopia and you have myopia, you cannot wear their glasses. You're going to have to get your own specific pair of glasses custom to your unique eyeballs from your eye doctor. You can also use contact lenses. There's lots of different options out there as far as soft contacts go, and in some cases, if it's very, very extreme, there's options for hard contact lenses such as hybrid lenses, scleral lenses, and corneal gas permeable lenses, depending on your type of prescription. And why does it matter? Every year, if you have a child that has myopia and you're taking them to the eye doctor, you will notice their myopia gets worse every single year. And that is just what happens with myopia. It's a progressive condition, so it's always getting worse and worse and worse. So if you don't integrate at a very young age or an early age, what can happen is their myopia can get very, very high. And with high amounts of myopia, your child will now be at risk for things like retinal detachments, glaucoma, macular degeneration, and cataracts. So it's really important, if you have a child that is diagnosed with myopia, make sure to ask your eye doctor about different options to help slow down the progression of myopia. Now, if you have hyperopia, you don't have exactly the same issues as somebody with myopia. Some of the things that can happen are you can get reading glasses or lose your up-close vision a bit earlier. So presbyopia, which is another fancy term for you can't see up close anymore, usually happens around 40 years old, and that's why a lot of people are reading glasses. Somebody that has hyperopia is going to need reading glasses sooner than somebody that has myopia. Another thing that can happen is something called angle closure glaucoma. That is something that if somebody has hyperopia and it's a very large amount, they might be more at risk for that condition. That is considered an ocular emergency if you do end up showing signs and symptoms of that. But if you have that going on, or you've got something going on where you think you might have an issue because you have such high hyperopia, it's always a good idea to check with your doctor to make sure that you're not developing any of these severe eye issues. I hope you found that video helpful as far as the differences between myopia and hyperopia and how to treat them. If you liked this video, make sure you subscribe to our YouTube channel, and don't forget to book an appointment below. We'd love to chat and connect with you and see if there's any way we can help you and answer any of your questions. Have a nice day.